Hi, and welcome. Today, we will review the CogniView Thrive report so that you feel prepared and empowered during conversations with your patients. Please note that it is your clinical decision how much information you choose to share and/or explain regarding the individual cognitive domains and the patient's performance in each of these areas. Later in this video, you will view an example of how a clinician might present the results to a patient. So let's begin. The CogniView Thrive report is designed to help guide discussions regarding the patient's performance on cognitive tasks. For the clinician, this report provides an opportunity to learn more about how the patient is performing in areas of the brain that are important to communication, particularly in complex environments. It is always important to remind patients that this is simply an assessment that will help you, the clinician, to develop a treatment plan individualized to their needs. Now let's take a closer look at the report to review the individual cognitive domains and how they respectively impact hearing and communication. Starting with memory. Memory is the ability to retain information while simultaneously processing the same or new information. Audiological connection is that problems parsing out of complex sentences and recognizing speech in degraded conditions. Take note of the ranges here at the bottom. You'll see as we go through each domain that the ranges will change, which means a score in the green in one domain might be a yellow in another. Next, we'll talk about visuospatial, which is the ability to process and interpret visual information, where things are in space and in relation to one another. The audiological connection is regarding localizing sounds, utilizing visual cues effectively, and then processing complex sentences and recognizing speech in degraded conditions. Once again, you'll notice the normative ranges at the bottom are different for each domain. Here, a score of 65 would be considered normal, where a 65 on the memory scale is yellow. The next key domain is executive function. An executive function coordinates and controls higher order cognitive processes. It guides attention, planning, problem solving, and more. The audiological connection is the ability to focus on a single speaker in noise, the ability to focus on multiple speakers at once, and the ability to focus on speech stimuli while ignoring irrelevant distractions. Again, take note of the different ranges. This slide points out reaction time, which is the time between stimulus perception and response. The audiological connection is the ability to respond quickly as needs dictate. This slide discusses processing speed, which is the time to mentally process a task. The audiological connection is the ability to follow rapid and/or complex conversations, particularly in challenging listening environments. As I mentioned earlier, it is important to remember that you get to determine how you share this information with your patients. In the following example, you will hear Dr. Jill Davis, a CogniView user, to demonstrate how she counsels her patients regarding their results.
You did fantastic. Overall, your score was excellent. There was just one part where we see that you didn't perform as well as we would like, and we want to keep an eye on that. The good news is that we're going to treat your hearing loss and do everything we can to get that stimulation back to the brain, because research shows that with hearing aid use, we can actually see an improvement in cognition. There's a lot of other factors that go into this cognitive score, and so I do want to mention to your physician that we had this test. Do you want me to send a report to them? I'd be happy to, or you could take this at your next visit. But we're going to test you again after we treat your hearing loss, and we're going to keep an eye on those scores.
I hope that it was helpful to see one of your peers delivering CogniView results. Before we wrap up, I want to show you an example of the various pathways a patient may follow based on the results of their CogniView assessment. As you can see here, a red result in any of the cognitive domains warrants a referral to primary care or neurology so that the patient can have a more thorough assessment of their cognitive function. The yellow zone is one that allows you to apply clinical knowledge and patient history to determine the best treatment pathway for your patient. If the patient is solidly in the green, they can and should continue to maintain a healthy lifestyle, which includes proactively managing risk factors associated with cognitive decline, including hearing health. Finally, some key points to remember. Scoring is not based on a scale of 1 to 100 across all domains. Each score and color is representative of only that domain. A moderate yellow score does not alone indicate cognitive decline or impairment, and a moderate yellow score may not correlate to noticeable changes by the patient in their everyday life. A moderate yellow score may indicate that the brain is working harder to perform hearing, speech processing in complex, everyday environments, and this is commonly referred to as an increased cognitive load. By addressing cognitive load through hearing correction or other clinical interventions, you are taking proactive measures to help protect your patient's cognitive health. Thank you. Thank you for your time, and the CogniView team looks forward to supporting you and your practice through this implementation.